So you might have been diagnosed with knee osteoarthritis and might have been suggested to do a knee replacement surgery by your orthopedic doctor. Here's how physiotherapy can help you post knee replacement surgery. Hi, this is Dr. Khushboo Gadda. I am a physiotherapist having my own clinic, FitFully Yours Physiotherapy Clinic at Vadala West. Today we will be discussing about a few tips on how you can manage your post-operative pain after a knee replacement surgery and how physiotherapy can help you after that. Usually after a knee replacement surgery, physiotherapy is prescribed for a few months and you are told to go home and start doing it. Physiotherapy post knee replacement surgery helps in reducing pain, swelling, improving the range of motion of your knee joint and to improve the strength of your legs so that you can walk better. So far, physiotherapy has been termed as something that is done to you, but physiotherapy after a knee replacement surgery is supposed to be done along with you talking to your physiotherapist about what your individual goals are, what you want to achieve after 6 months to 1 year after the replacement is done. Physiotherapy is usually done for at least 3 months after a knee replacement surgery, and you need to keep regular follow-up with your physiotherapist at 6 months to 1 year, up to 6 months to 1 year after your knee replacement is done. This is because it takes that long for your muscles to become strong and for you to achieve your goals. Your goals can be being able to climb the steps of your favorite religious place. Your goal can be being able to go and visit your relative's house where there is no lift available inside the building and you have to climb 3 floors of steps. Your goal can be being able to jog or run in a marathon after your knee replacement surgery. For any kind of goal, physiotherapy is very important and you need to speak with your physiotherapist about what your goals are and how we can achieve it. What is prehab? Prehab is exactly as it is termed, pre-rehabilitation. So before you undergo knee replacement, 1 month before that you can undergo physiotherapy and you can start doing the exercises that are recommended to you after the surgery. How this will help? This will help in strengthening your muscles before they actually get operated upon. It will help you to know the exercises before the surgery, as after the surgery you will be in more pain. So it will be much easier for you to do the exercises after your surgery is done. And in general, the outcomes after physiotherapy is done before the surgery is much better than just doing physiotherapy after your surgery. We provide physiotherapy services for your knee pain and knee replacement surgery at our clinic, FitFully Yours Physiotherapy Clinic in Vadala West. To know more and to book an appointment with us, you can contact the below number and schedule an appointment with us. Thank you.